Vanakkam. Just imagine three situations where you are going to the doctor and the doctor is seeing you for the first time. Yes, how can I help you? Yes, how can I help you? Yes, how can I help you? You would have noticed that the doctors depicted in these three instances had different attitudes. The words they said were the same, but the attitude was different. This doctor seemed to have an arrogant attitude. This doctor appeared to be apathetic, that is, he did not seem interested in the welfare of the patient. This doctor appeared to be genuinely interested in the welfare of the patient. We are not being judgmental, but this is how it appears. Now consider three different types of patients coming to see the doctor for the first time. Doctor, I want you to treat my problem immediately. Doctor, I want you to treat my problem immediately. Doctor, I want you to treat my problem immediately. Similarly, you would have noted that the three patients who were depicted all said the same words, but again the attitude was different. This kind of patient appears to be emotional, overwrought, and can sometimes turn aggressive also. This kind of patient, on the other hand, appears to be a person who is reasonable, rational, and will follow the instructions given by the doctor. This patient appears to be hiding some facts from the doctor, and this kind of patient may not follow the instructions given. This is what is called the body language. It is an important part of the doctor-patient relationship which can either make or mar the trust that has to form between the doctor and the patient if the correct treatment is to be given and received. Right? But what has all this got to do with Thirukkural? Thiruvalluvar, the saint poet, has said almost 2000 years ago all this in just 2-line couplets. Let us see two of them and how they are relevant to the doctor-patient relationship of today. If we as doctors are able to understand what the patient wants or what he feels without even having to actually put everything into words, our work as doctors will be half done, because understanding the patient is a very important part of the treatment process. Like the Thirukkural says,
கூறாமை நோக்கி குறிப்பு அறிவான் எஞ்ஞான்றும் மாறாநீர் வயக்கு அணி மாறாநீர் வயக்கு அணி.
It reads like this: கூறாமை நோக்க குறிப்பறிவான் எஞ்ஞான்றும் மாறாநீர் வையக்கணி. The word கூறாமை means without saying anything, without saying a word. Nokka refers to just by a single look. Kuriparivan refers to will understand. Engyandrum refers forever, in any time. Mara Neer refers to the waters that never change. Here he refers to the oceans. Vayyakani. Vayyam refers to the earth, the world, and Ani refers to a jewel or a decoration, an asset. Without a single word being said, just as the oceans understand the needs of the people and provides the fresh water and detoxifies the atmosphere and is an important asset for living, the minister who understands the king's gestures and the doctor who understands the patient's needs, without any words being said, are indeed assets. There are 6 points of non-verbal communication between the patient and the doctor that are significant. The first is silence. The doctor first needs to be silent when the patient is telling his problems. This silence on the part of the doctor will communicate to the patient that his problems are being heard. This silence can also at times calm down an angry or restless patient. The second important feature is the facial expressions. The patient's worries and his anger will be seen in the facial expression that should be understood by the doctor. Similarly, the doctor's facial expressions will indicate whether he is really interested or not. A genuine smile will definitely aid in communication on both sides and help in building trust, which is so important in the treatment process. There are two behaviors by the doctor that should be avoided. The first is a poker face or a face devoid of expression. This communicates to the patient that he is not interested. The second expression that must be avoided is that he is fatigued or rushed for time. These affect the patient negatively. Eye contact. The next important feature is the eye contact. Maintaining eye contact conveys to the patient that the doctor is interested in knowing about the patient and expresses attention and encourages the patient to express himself or herself better. If the patient is not making eye contact, he is not being forthright and is hiding some problems that need to be told to the doctor to be able to start a correct treatment process. Body language or kinesis is also important. Gestures, posture, head and hand movements, whole body movements are all important. When the doctor has an open stance with hands on the sides and positioning the body to face the patient, it means that he is willing to listen. At the same time, if the patient sits back and is continuing to look around the room, he is not attentive. Posture conveying an unhurried attitude is a very positive signal on the part of the doctor. Distance. The personal space of a person is supposed to be between 45 centimeters and 125 centimeters. The correct social distance for communication is 125 to 360 centimeters. The doctor must come into this social distance to be able to communicate correctly with the patient. A doctor peeping in at the door of the patient's room asking if the patient feels okay is not good, as it indicates that the doctor is not actually interested. Finally, we need to talk about paralanguage. It is not the language as such, but the tone of the voice, the volume and the pitch that also play a role. Of all these non-verbal communication methods, the communication from the face, the communication from facial expressions is the most important. Even the Thirukkural says this very categorically.
அடுத்தது காட்டும் பளிங்கு போல் நெஞ்சம் கடுத்தது காட்டும் முகம் அடுத்தது காட்டும் பளிங்கு போல் நெஞ்சம் கடுத்தது காட்டும் முகம்.
It reads as follows. அடுத்தது காட்டும் பளிங்கு போல் நெஞ்சம் கடுத்தது காட்டும் முகம். அடுத்தது refers to what is close by. காட்டும் shows. பளிங்கு போல் refers to a mirror or a polished granite or marble. Ninjam, the heart or the mind. Kaduttadu, what it feels. Katum, will show. Mukham, the face. The lips may speak any words, but the face will show what is going on in the mind. For instance, the smile. With a true, genuine smile, the corners of the mouth turn up and the eyes narrow and wrinkle at the corners. Insincere smiles generally don't involve the eyes. They can happen in response to discomfort also. A smirk or a partial smile is an expression of displeasure or contempt and can suggest uncertainty, disdain or even dislike. The lips also show expression. Compressed or narrowed lips can suggest unease. Quivering lips can suggest fear or sadness. Pursed lips indicate anger. Open, slightly parted lips show that the person is relaxed or at ease. Blinking is also indicative of expression. People tend to blink rapidly when they are under some sort of stress. The blinking speed usually becomes more when they are working through a difficult problem in their mind, they are feeling uncomfortable, or afraid or worried about something. So note the blinking in the patient. More blinking will tell you that the patient is not comfortable. If you are able to note the pupil dilatation, this is also an important indicator of the person's inner feelings. Dilatation happens in response to arousal of the nervous system. So if someone's angry or afraid, the pupils may be dilated. And when you don't like something, your pupils usually contract. The eyes generally tend to follow what the person is interested in. So if your patient is sitting in front of you and keeps looking at the examination couch, which is on the side, it means that they are worried about the examination. People also tend to move their eyes down and to one side when they are working through a problem or recalling information or memories or thinking about something difficult. Eye blocking, like for instance, the patient covers his eyes with a hand or closes his eyes briefly as in a long blink or rubbing his eyes or squinting. This happens usually when the patient is irritated, distressed or faced with something they don't particularly want to do. The patient may actually not realize it. If you suggest a surgery to be done and the patient doesn't really want it, immediately his hands would go to his eyes. Taking this cue, we can reassure the patient about the procedure. So the next time you see a patient, watch the non-verbal communication that is coming from the patient so that you can understand your patient better to provide a better treatment. And at the same time, we need to control our negative emotions and our negative body language so that it does not affect the patient. கூறாமை நோக்க குறிப்பறிவான் எஞ்ஞான்றும் மாறாநீர் வையக்கணி அடுத்தது காட்டும் பளிங்கு போல் நெஞ்சம் கடுத்தது காட்டும் முகம். I hope you enjoyed this video. I enjoyed making it. Please click on the shown links to see other Thirukkurals and their relevance to our day-to-day life. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.